Alright, hi, I'm Ian Vasquez again, and today I'll be talking about infection control. Alright, so why is infection control important? Infection control basically prevents transmissions of diseases causing agents that cause bacteria. And with this, it's basically preventing patient to provider transfer, the practitioner to patient, staff to patient. So all these things are basically preventable if you follow the infection control. Alright, these are some guidelines. In the Navy, we utilize the BMED instruction and the CDC as far as disease control and whenever we adhere to infection control. Right. Bloodborne pathogens. Bloodborne pathogens, you want to try to prevent the exposure of bloodborne pathogens by basically using PPE. So PPE, your face masks, your gloves, all of that. Bloodborne pathogens can also be contracted through sharps. So like your needles, sharp instruments, just anything, even surface. So all that. Right. Another way that we adhere to infection control is by making sure that our water lines are clean. So we utilize this thing called ICX tablets. We don't use bleach, and we use distilled water whenever we basically rinse the patient's mouth and things like that in a dental laboratory. As far as water lines, you want to make sure that you flush all your water lines. This basically helps prevent any cross-contamination from the patient to the water that you utilize. So the ICX tablets also help that. You also want to flush your lines at least like 2 to 3 minutes in between patients and after the procedure, so that helps prevent that cross-contamination. We also use waterline testing. Waterline testing you basically grow the bacteria by using the water in that lines to see if there's anything that's left over. So that's another way we help control bacterial growth. All right, hand washing. Obviously, we got to use hand washing